There are changes we rarely talk about, the quiet ones that steal comfort from ordinary moments. A gentle walk now comes with a sting. Clothing that used to feel soft can turn scratchy. Intimacy becomes something you think about more than you enjoy. It's not vanity, and it's not just age. It's a sign your tissues want care, real steady nourishment, so you can feel like yourself again. Today, I want to place that care in your hands with a simple, natural option that many of my patients have found soothing and effective. I'm Dr. Emily Hart. For more than 15 years, I've helped women move through midlife with clarity and compassion. If you're new here, welcome to a community that believes aging should feel strong, dignified, and deeply you. If this message helps, subscribe and join us. And tell me in the comments where you're watching from. I love seeing this circle of wise, resilient women from all over the world. Let's begin with what's really happening, because understanding your body is the first relief. When estrogen drops after menopause, the vulva and vaginal tissues lose moisture and elasticity. The surface can thin, natural lubrication decreases, and nerves become more sensitive. Doctors now call this the genitourinary syndrome of menopause, GSM for short. It's common, and it's not your fault. Importantly, it tends to be persistent, which is why consistent care matters more than quick fixes. Non-hormonal options like moisturizers and gentle lubricants are first-line support for many women, especially if hormones aren't your path. I think of this as comfort you can layer, like adding a soft scarf on a cool day. We still support circulation, hydration, and pelvic floor relaxation, but we also feed the tissue directly. That's where my #1 natural oil comes in: vitamin E. Not a scented body oil, not a trendy blend, simple vitamin E used thoughtfully for feminine dryness and comfort. Why vitamin E? Because the science suggests it helps the cells that line the vagina and vulva maintain their protective barrier. Vitamin E is an antioxidant. It helps stabilize cell membranes. Imagine patching tiny cracks in a brick wall so moisture stays in, irritation stays out, and the surface feels calmer over time. In small randomized trials, vitamin E used intravaginally improved dryness and discomfort compared with placebo, and in some measures performed similarly to low-dose vaginal estrogen, though more research is still needed. Let me bring this to life with someone I'll call Carol, age 68. Carol had started planning around discomfort, choosing certain underwear, avoiding long walks, even hesitating before intimacy because she worried it would hurt. She wasn't ready for hormones and wanted something gentle she could try now. We set up a simple plan: a pre-made vitamin E vaginal suppository a few nights per week, plus a pea-sized amount of pure vitamin E oil externally at bedtime on off nights. Within 3 weeks, she felt less burning. By 6 weeks, she said, "I can sit through a movie again without thinking about it." This is the power of steady care. Not perfection, just a kinder baseline. If this is resonating, give this video a like. It tells me topics like this matter and helps other women find support. Here's how vitamin E fits into a practical routine. First, choose the right form. For internal moisturization, I prefer pre-made vitamin E vaginal suppositories from reputable brands, products designed for vaginal use, with simple ingredient lists. These are easy to insert at bedtime, which reduces leakage and lets the tissue absorb moisture overnight. If suppositories aren't available where you are, some women use a small amount of pure vitamin E oil applied just inside the vaginal opening with clean hands, and a pea-sized amount to the external vulvar skin. Keep it modest, more isn't better. And stay consistent 2 to 3 nights a week, adjusting based on comfort. As always, if you have a history of sensitivities, start with a tiny amount and monitor. What results feel like matters. In clinic, women describe soothing instead of stinging when they sit, less friction with daily movement, and greater ease during intimacy when paired with a lubricant. It's not meant to numb or tingle. It's meant to restore softness and help your body hold moisture. Science-wise, think of your tissue like a garden bed after a hot summer. The soil is dry and crumbly, water drains too fast, tiny cracks form. Vitamin E helps the soil hold moisture again, supporting the cells that make natural lubrication. Trials are small but encouraging. In one placebo-controlled study, women using vitamin E suppositories reported fewer symptoms over 8 weeks. In others, higher-dose vitamin E performed similarly to low-dose vaginal estrogen on certain measures. That said, a study comparing vitamin E to hyaluronic acid, a non-hormonal vaginal moisturizer, found hyaluronic acid had an edge, which is why I often combine approaches: vitamin E for barrier support and comfort, and a hyaluronic acid-based vaginal moisturizer a few times a week to pull water into the tissue. Now, an important safety note about intimacy. Oil and latex do not mix. Any oil, including vitamin E and coconut oil, can weaken latex condoms and latex diaphragms, increasing the risk of breakage. If you rely on those barriers, use a water-based or silicone-based personal lubricant during intercourse and keep your vitamin E routine to non-intimate times, like bedtime. If you don't rely on latex and you tolerate oils well, that's a separate conversation, but I still lean toward condom-compatible lubricants during intimacy for many women. Your comfort and protection come first. Let's talk about coconut oil because it's a popular question. Coconut oil can feel silky and soothing externally for some women, and I do occasionally recommend it for the vulvar skin when latex isn't in use and there's no history of yeast infections or sensitivities. But it's not my first choice for inside the vagina. Coconut oil can alter the vaginal environment in ways some women don't love, and again, it's never compatible with latex. For internal moisture, vitamin E or a dedicated vaginal moisturizer is generally more predictable, with better studied outcomes. Another story for you: Marta, 62, a retired teacher. She'd switched laundry soaps, underwear, fabrics, even her body wash, but the burning persisted. We kept it simple: a fragrance-free routine, warm water cleansing only, cotton underwear, and vitamin E at night. We also added a hyaluronic acid vaginal moisturizer every third night. She messaged me after 2 weeks. "I forgot I was uncomfortable today." That's my favorite sentence. If you're wondering about timing and rhythm, aim for consistency over intensity. Many women start nightly for a week or two to load, then step down to 2 or 3 nights weekly. If you add a hyaluronic acid moisturizer, alternate nights so you're not layering too many products at once. Your tissue needs moisture and calm, not complexity. If you notice any irritation, pause, rinse gently with warm water, and reassess. Sometimes it's an added fragrance or herb causing trouble, rather than the vitamin E itself. And if you've had unexplained bleeding, pelvic pain, or recurrent infections, please see your clinician before starting anything new. I also want to explain how this fits alongside medical care. Some women do beautifully with non-hormonal approaches like vitamin E and hyaluronic acid moisturizers. Others need prescription options, low-dose vaginal estrogen, DHEA, or other therapies, especially if symptoms are moderate to severe or affecting bladder health and intimacy. These treatments are targeted and generally safe for many women, but your history matters. Think of vitamin E as part of a spectrum. It may be enough on its own, or it can support comfort while you and your clinician decide on the next step. While we're nourishing the tissue from the outside, let's support it from the inside. Hydration helps every mucous membrane in your body. Gentle movement, especially walking and pelvic floor relaxation, improves blood flow to the pelvis, bringing nutrients where healing happens. Even 5 minutes of diaphragmatic breathing before bed can reduce tension in the pelvic floor, which many of us hold without noticing. Imagine the breath as a warm wave. Inhale as the belly softens, exhale as the tailbone feels a little heavier into the bed. This downshift works beautifully with a bedtime vitamin E routine. Here's a simple bedtime ritual many of my patients love. After a warm shower, pat dry and apply a pea-sized amount of pure vitamin E oil to the external vulvar skin. If you're using a suppository, insert it just before lying down. Slip into loose, breathable cotton underwear. Spend a few minutes with that gentle breathing. Release your jaw, drop your shoulders, let the pelvis soften. This is care, not a chore. Over a few weeks, you're training your tissue and your nervous system to feel safe again. You may be wondering how quickly you'll notice change. Everyone's timeline is different, but many women report softer, calmer skin within 1 to 2 weeks, and more comfortable daily movement by week 3 or 4. For intimacy, pair your routine with a high-quality, condom-compatible lubricant during activity. That instant glide matters. Keep your bedtime vitamin E habit steady in the background so comfort slowly becomes your new normal. One more piece that often gets missed: reduce the quiet irritants. Avoid scented soaps and bubble baths. Use fragrance-free laundry detergents. Rinse with warm water rather than scrubbing. Skip panty liners unless you truly need them. They can trap moisture and cause friction. Small changes, big comfort. When you build a calm environment for the vulva and vagina, your moisturizing routine can shine. A final note on expectations. Vitamin E is gentle, not magical. The studies are promising but small. We need more data to know exactly who benefits most and the ideal dose. Yet the risk profile is low when used appropriately, and the feel of the tissue often improves even before the numbers do. If you ever develop irritation, bleeding, or persistent symptoms despite your routine, connect with your clinician to rule out other causes and discuss next steps. Women deserve options, and you have them. I want to end where we began, with your dignity. You are not too old. You are not broken. And you are absolutely not alone. Your body is worthy of steady, loving care, and relief is possible. If today gave you a path forward, subscribe and stay close to this growing circle of strong, informed women. Tell me in the comments what has helped you most. Your tips often become another woman's turning point. And if someone you love needs this message, share it with her. Take care of yourself. You're worth it. I'm Dr. Emily Hart, and I'll see you in the next one.